Hi, I'm Dr. Giordano. Welcome to Dental Bytes, a way to get to know who we are by what we do.
Our topic for this Dental Bite is sleep disorders and their critical connection to your overall health. Do you have trouble falling asleep or staying asleep? Do you wake up several times during the night? Do you snore? Do you take over-the-counter or prescription drugs for headaches? Do you clench or grind your teeth at night? How about during the day? If you have answered yes to any one of these questions, you may have a sleep disorder. Let's take a look at why sleeping well is so important to your overall health. Light cycles drive internal systems in all animals, and humans are no different. Nature dictates that we sleep during the dark and are awake during the light of day to optimize our systems. Man first extended the day using firelight, then electricity. Consider this. Nature would have us sleep 4,370 hours out of the possible 8,760. Today, we might sleep 2,555 hours. In 1970, Americans devoted 27 hours a week to leisure. Today, we might devote 15 hours a week. As a result, extending our days has taken a serious toll on our health. People are sick in part because they are tired. Hormones influence many physiological processes in the body. At least 10 different hormones, as well as many neurotransmitters in the brain, are affected when you don't sleep. Sleeping controls eating and stress. Eating and stress in turn control reproduction. And all these together control aging. So in the end, not enough sleep has the ability to increase obesity, hunger, impotence, hypertension, and cancer. Bottom line, all work and no sleep have made Americans very sick. A leading cause of sleep deprivation is sleep apnea, a sleep disorder characterized by pauses in breathing during sleep. Each episode, called an apnea, lasts long enough so that one or more breaths are missed, and such episodes occur repeatedly throughout sleep. This can either lead to wakefulness or feeling unrested and unrefreshed when the alarm clock goes off. There are two types of sleep apnea: central, which is neurological, and obstructive, which means you have a blocked airway. A dentist can only treat obstructive sleep apnea, or OSA. The pathology of snoring is the same for OSA. However, not all people who snore have sleep apnea, although it is the most noticeable symptom. The percentage a person snores is directly related to the prevalence of coronary disease. In other words, the more one snores, the greater risk for stroke. Reasons for airway obstruction leading to OSA include large tonsils, underdeveloped upper jaw, tongue piercings, obesity, low palate, restricted tongue, craniofacial anomalies, and medications. Symptoms such as morning headaches, GERD, bruxism, which is grinding and clenching of your teeth, waking unrested, using over-the-counter sleep aids, sore throat, and TMJ pain can all be associated with sleep disorders. Besides macro trauma, such as accidents, sleep disorders are the primary cause of TMD, which is temporomandibular dysfunction. Sleep apnea isn't just an adult issue. It affects children too. It is critical to diagnose airway obstruction in children for many reasons. First of all, if they don't sleep, they don't secrete the growth hormone. These children are also likely to have daytime cognitive and behavioral problems, including paying attention, aggression, and hyperactivity, which can lead to problems at school. If you suspect that you have a sleep disorder, a sleep study, or PSG, is the tool used for diagnoses. The American Academy of Sleep Medicine has determined that first-line therapy for mild to moderate sleep apnea can be an oral appliance. The recommended treatment for severe apnea is the CPAP. However, if you cannot tolerate the CPAP, an oral appliance can be recommended. In some instances, patients wear both the CPAP and the oral appliance to optimize their results. Once the diagnosis of OSA or snoring is confirmed, and it is determined that an oral appliance is recommended, Dr. Giordano can help. He will design an FDA-approved, comfortable, removable oral appliance that will place the jaw in the best position to breathe and in the most comfortable and healthy position for your temporomandibular joints. This is a very important aspect, as improper positioning can cause harm to the TMJs. These appliances are monitored by our take-home sleep study system to ensure maximum benefit. Once we believe that you have achieved maximum medical improvement, we will recommend that you go back to your sleep doctor and have a PSG done as well. In the past, the CPAP has been the only option given to patients. However, compliance can often be very challenging for patients. Oral appliances are now a great option for those who suffer from snoring or mild to moderate sleep apnea, and even those who suffer from severe sleep apnea and are intolerant to the CPAP. In other words, wearing something is better than doing nothing at all. If you snore or think you suffer from OSA, please give our office a call today and schedule an evaluation. It all boils down to this: sleep well, live healthier, live longer.